Guillain-Barré syndrome is a rare disorder in which your body's immune system attacks your nerves. Weakness and tingling in your hands and feet are usually the first symptoms. These sensations can quickly spread, eventually paralyzing your whole body. In its most severe form, Guillain-Barré syndrome is a medical emergency. Most people with the condition must be hospitalized to receive treatment. The exact cause of Guillain-Barré syndrome is unknown. But 2/3 of patients report symptoms of an infection in the 6 weeks preceding. These include a COVID-19, respiratory or a gastrointestinal infection or Zika virus. There's no known cure for Guillain-Barré syndrome, but several treatments can ease symptoms and reduce the duration of the illness. Although most people recover completely from Guillain-Barré syndrome, some severe cases can be fatal. While recovery may take up to several years, most people are able to walk again 6 months after symptoms first started. Some people may have lasting effects from it, such as weakness, numbness or fatigue. Symptoms. Guillain-Barré syndrome often begins with tingling and weakness starting in your feet and legs and spreading to your upper body and arms. Some people notice the first symptoms in the arms or face. As Guillain-Barré syndrome progresses, muscle weakness can turn into paralysis. Signs and symptoms of Guillain-Barré syndrome may include 1. A pins and needles sensation in your fingers, toes, ankles or wrists. 2. Weakness in your legs that spreads to your upper body. 3. Unsteady walking or inability to walk or climb stairs. 4. Difficulty with facial movements, including speaking, chewing or swallowing. 5. Double vision or inability to move the eyes. 6. Severe pain that may feel achy, shooting or cramp-like and may be worse at night. 7. Difficulty with bladder control or bowel function. 8. Rapid heart rate. 9. Low or high blood pressure. 10. Difficulty breathing. People with Guillain-Barré syndrome usually experience their most significant weakness within 2 weeks after symptoms begin. Types. Guillain-Barré syndrome has several forms. The main types are 1. Acute inflammatory demyelinating polyradiculon neuropathy, AIDP, the most common form in North America and Europe. 1. The most common sign of AIDP is muscle weakness that starts in the lower part of your body and spreads upward. 2. Miller-Fisher syndrome, MFS, in which paralysis starts in the eyes. 2. MFS is also associated with unsteady gait. 2. MFS is less common in the US but more common in Asia. 3. Acute motor axonal neuropathy, AMN, and acute motor sensory axonal neuropathy, AMSAN, are less common in the US but AMN and AMSAN are more frequent in China, Japan and Mexico. Causes. The exact cause of Guillain-Barré syndrome isn't known. The disorder usually appears days or weeks after a respiratory or digestive tract infection. Rarely, recent surgery or vaccination can trigger Guillain-Barré syndrome. There have been cases reported following infection with the Zika virus. Guillain-Barré syndrome may occur after infection with the COVID-19 virus. It's also a rare reaction in those who receive the Johnson & Johnson or AstraZeneca COVID-19 vaccine. In Guillain-Barré syndrome, your immune system, which usually attacks only invading organisms, begins attacking the nerves. In AIDP, the nerve's protective covering, myelin sheath, is damaged. The damage prevents nerves from transmitting signals to your brain, causing weakness, numbness or paralysis. Risk factors. Guillain-Barré syndrome can affect all age groups, but your risk increases as you age. It's also slightly more common in males than females. Guillain-Barré syndrome may be triggered by 1. Most commonly, infection with Campylobacter, a type of bacteria often found in undercooked poultry. 2. Influenza virus. 3. Cytomegalovirus. 4. Epstein-Barr virus. 5. Zika virus. 6. Hepatitis A, B, C and A. 7. HIV, the virus that causes AIDS. 8. Mycoplasma pneumonia. 9. Surgery. 10. Trauma. 11. Hodgkin's lymphoma. 12. Rarely, influenza vaccinations or childhood vaccinations. 13. COVID-19 virus. 14. COVID-19 Johnson & Johnson and AstraZeneca vaccine. Complications. Guillain-Barré syndrome affects your nerves. Because nerves control your movements and body functions, people with Guillain-Barré may experience 1. Breathing difficulties. 1. The weakness or paralysis can spread to the muscles that control your breathing, a potentially fatal complication. 1. Up to 22% of people with Guillain-Barré syndrome need temporary help from a machine to breathe within the first week when they're hospitalized for treatment. 2. Residual numbness or other sensations. 2. Most people with Guillain-Barré syndrome recover completely or have only minor, residual weakness, numbness or tingling. 3. Heart and blood pressure problems. 3. Blood pressure fluctuations and irregular heart rhythms, cardiac arrhythmias, are common side effects of Guillain-Barré syndrome. 4. Pain. 4. 1/3 of people with Guillain-Barré syndrome experience severe nerve pain, which may be eased with medication. 5. Bowel and bladder function problems. 5. Sluggish bowel function and urine retention may result from Guillain-Barré syndrome. 6. Blood clots. 6. People who are immobile due to Guillain-Barré syndrome are at risk of developing blood clots. 6. Until you're able to walk independently, taking blood thinners and wearing support stockings may be recommended. 7. Pressure sores. 7. Being immobile also puts you at risk of developing bed sores, pressure sores. 7. Frequent repositioning may help avoid this problem. 8. Relapse. 8. A small percentage of people with Guillain-Barré syndrome have a relapse, experiencing muscle weakness even years after the symptoms ended.